Over the last 24 hours, we have identified 257 new cases of COVID-19. We completed about 5,864 tests, and our positivity rate is about 4.5%. Looking to schools, there are currently active alerts or outbreaks in 228 schools, or about 9% of all schools in the province. These schools have had a combined total of 876 cases since January 11th. We have identified 35 additional cases of the variant, bringing our total to 492. There are currently 261 people in hospital, including 54 admitted to the ICU. Sadly, I must announce that 2 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family and friends of these individuals and to anyone who is mourning a loss. As Chief Medical Officer of Health, I recognize the important role physical activity and fitness play in our overall physical and mental health. That's why we've worked hard to find ways to safely open up fitness facilities for lower risk activities in collaboration with the operators of these facilities. We heard from fitness industry representatives in the multiple meetings our team has had with them how important it is for us to underline the critical role that physical activity has in both physical and mental health. We heard that allowing appointment-based solo activity was important, and we heard that fitness owners are committed to creating safe environments to prevent COVID-19 spread.
So as we announced yesterday, Step 2 allows for some individual and some group fitness to go ahead. And there's been considerable confusion about what is allowed and what is not allowed. So Dr. Hinshaw and I are here today to clear some things up. And let me start off by saying that this pandemic has been challenging for all of us, and our government has been committed to providing the clearest information that we can. Anytime there's confusion or there are questions, we'll work to address them and provide answers to Albertans as best as we can. Now, yesterday, we announced a small change to allow more Albertans to resume indoor fitness. Now, Dr. Hinshaw will review the details in a moment, but let me be clear. If you operate a gym, you can be open. That is perfectly within the rules. Before we announced Step 2, we consulted with the fitness sector about how to safely support their industry. And they told us clearly that they supported us going to an approach similar to the one that is used in BC. And that's what we did. And it's why we adopted the distinction of high versus low intensity. Now, low intensity solo and group fitness activities will now be allowed indoors. They can be done anytime, provided that you make an appointment. Low intensity fitness is stuff that doesn't make you breathe significantly harder than you usually do. High intensity fitness is any kind of exercise that does make you breathe a lot harder than usual. And the higher your heart rate, the higher your breathing rate will be. Now, it's not about what activity you're doing or where, it's about the intensity. Now, we know that this will vary between people and depending on somebody's individual level of fitness. And that's why gym and studio and fitness center operators need to use their best judgment in identifying what category their group exercises or exercise classes fall into. And we've worked with the fitness industry from the beginning and will continue to do so. We recognize that this is challenging and there are going to be questions, there are going to be issues about exactly how to apply this in practice. So I want to be clear. We're relying on owners and clients to use judgment, to show good faith. We need people to follow the rules. But as with all of AHS's work to enforce public health measures, the goal is compliance. It's not sanctions. We're not looking for opportunities to hand out tickets. We're not looking to close businesses. We want people to use gyms and other facilities safely. Enforcement, remember, is only ever a last resort. I should also say that we'll be hosting a telephone town hall with fitness operators shortly to answer any confusion that they may be feeling, to answer their questions. And as I said yesterday, step 2 is another safe, another smart step forward for our province. We're proceeding cautiously, but we're also hoping that we can ease more measures in the coming weeks if we see our triggers start to decline again.